It's visible, Dr. Anil.
Yeah, sure. Sir.
Yep.
So, good evening, everybody. This is Dr. Anil, and I'm from the first batch of DrNB Neuroanesthesia. So, as Sir has told before, this is a brief introduction about the exam pattern, including both theory and practicals. So, here we go. And Dr. Karthik is going to share the talk, and you can ask if you have any queries. You can interrupt in the middle. Yeah. So before going to start this, so as you know, the DrNB Neuroanesthesia, this is the second year, and you are the second batch. And we have 3 papers for theory, and the marks for theory are 300. And we have 3 papers, paper 1, 2, and 3. So each paper has 100 marks. So 10 questions will be asked. And for each question, there will be a clear-cut distribution of marks. For example, as one of our seniors have shared the last year question paper. So here I'll just read one question so that you can get an idea. So the first question in paper 3, which was conducted in December 2020, here they have asked, describe the principles of neuroprotection, discuss the various strategies for neuroprotection during neurosurgical procedures. And here the mark distributions were like, for principles of neuroprotection, they have given 3 marks. And for various strategies for neuroprotection during neurosurgical procedures, they have given 7 marks. So I think most of you have entered this course with MD. Some of you would have done DNB in PG. So those who have who are doing this DrNB through MD, they might feel this as a bit new, because the mark distribution and everything which is gonna be asked in the theory and practicals will be a bit different. So that's why. So here the mostly they'll expect us to answer in based on the marks distribution wise. So here is the syllabus which I'm gonna just show you guys. So this is the syllabus which has been mentioned in the NAT board site. So where it has all the basics of anesthesia, including neuroanesthesia. So it has even biostatistics also, and even the medical ethics, biomedical waste management, and research methodology, biostatistics. As this is the DNB NAT board examination, yeah, we are expected to even know about all these biostatistics and all. So we may expect a question in this. So I'll
change this.
Yes, sir.
Change the slide.
Yes, sir. So this is the basic sciences topics. All of you must have gone through all these topics. Just for some people who may be useful for them. So I'll just go through this. Yeah,
Anil,
yeah.
Still only the first slide is seen, not the following slides.
Yeah, first slide.
No. I can see only introductory slide. The slide is not changing.
Oh, okay. Yeah, now can you see this, Karthik?
Yes.
Yeah. So this is the first slide. So here is the syllabus. So the biomedical waste management, medical ethics, research methodology, biostatistics, infection control, or else organization of a neuro ICU setup. What is the criteria for ICU design? Everything can be expected. So just I would like to let you know all of you. So and then basic sciences. We should read about the neuroanatomy, physiology, including all the physiology of respiratory system, CVS, renal, and metabolic. So as you know, hyponatremia is a favorite question. So and it can be asked. So you guys have to prepare all this. If you have any queries, you can interrupt the discussion. You can interrupt. So and then pharmacology, mainly the dexmedetomidine has been asked. And then even in practicals, this is a favorite topic where for drugs, they have a separate station, and 25 marks is dedicated for drugs. So drugs means it includes everything like anti-epileptics, and then drugs which are which can be used in anti-edema measures like 3% saline, mannitol, or barbiturates, propofol, or else even the drugs which are muscle relaxants like vecuronium, atracurium, everything. So you should be thorough in all this. And then the topics like sedation in neuro ICU, the usage of muscle relaxants in neuro ICU, and and then role of anticonvulsants, everything will be is expected to be asked. So, and then even microbiology infections in neuro ICU, including pulmonary infections, nosocomial infections, and then meningitis is the one more important topic which you should know. And then coming to the clinical sciences, see, as our 3 papers, they are not following any division of syllabus like that per se. So for us, even in the first paper, they have asked the recent advances, and so they are not confined to the for a first paper only basic sciences should be asked like that. They're not following that. So we are expected to cover all the syllabus before appearing the first paper itself. So for us, we have written the first paper on the 3rd day due to some, Karthik will explain this. Karthik, you can explain that.
So no, nowadays, I think you guys have given the FAT, right? Where you get the online paper on the tab. So we had some issues. So our paper was cancelled for day 1. It was so they had, they scheduled it on day 4. So we wrote on 2, 3, and 4 number of days. So you guys will have to be mentally prepared to take up any paper at any point of time. There is no clear-cut demarcation. So just be mentally prepared and to take up the physical toiling. Initially, they said they're going to give us 2 papers in a day, one in the morning and one in the evening. Then I don't know, because there met some resistance, they said, okay, 1 paper per day. So you guys will have to be ready for that.
Yes. Yeah. And then I'll just go through these topics. I think all of you must have known about all this. Just I'll read this. So basically, yeah,
one second. Yeah, about in pharmacology, I think you guys will also have to know about the anticoagulants and their reversals, because that's a favorite question of because you see a lot of ICH, lot of trauma patients who will be on anticoagulants. So you might get that is a short question about what anticoagulant they are and what will be their specific reversal and their dosages. Yeah, what do you do?
Okay. So anesthetic management of all the tumors, supratentorial, infratentorial, and then vascular malformations, AB malformations, Arnold-Chiari malformations, spinal cord pathologies, posterior fossa tumors, skull-base tumor, skull-base repair, epilepsy, head injury, everything, and then endovascular procedures like ETV, and pediatric procedures for congenital hydrocephalus, meningomyelocele, and craniosynostosis. And then even these can be asked, difficult airway in pregnancy in who is presented for a neurosurgery. And then cerebral protection strategies. This has been asked in the December session. And then positions in neuroanesthesia. You can find this topic in Julfikar sir has written one book. I'll show you in the last. There, one chapter is dedicated for this positions, various positions in neuroanesthesia, and the complications associated with each position. And each particular position means, as we all know, sitting position cannot be used for all. At the same like that. So you should be thorough in all this, knowing all the positions and their indications and contraindications. And then monitoring. We have read in Cottrell, and then I'll show you the other book in the last. So where you should have a brief idea about the intraoperative neuromonitoring. EEG, I think we have got, Karthik, have we got any brainstem evoked potential for our exam?
I don't think so. We got only depth of anesthesia monitoring.
Okay, I remember drawing that waves in BA, but I'm not sure. So even intraoperative neuro monitoring, definitely we can expect one question.
Subhajit here.
Sir?
Shubhajit.
Yeah,
MEP
Subhajit.
was
Yeah,
also given, I think. MEP was given. One of the question was on MEP.
yeah.
MEP.
MEP is asked. Okay. And then neuroradiology, sedation in MRI suit, or sedation for seizure protocol, or MRI protocol for seizures. And then anesthesia for brain surgery with intraoperative MRI suit. I think this is the favorite, means this is the recent topic. I don't know. I think you can expect this topic also. And then recent advances means all the latest trials which has been done in acute ischemic stroke, ICH, and then topic like anesthetic neurotoxicity, perioperative disorders of cognitive function. So all these can be asked for recent advances, but they can be asked even in the first paper. And then neuroemergencies. So where it has TBIs, spinal cord injury, subarachnoid hemorrhage, status epilepticus, Guillain-Barré syndrome, critical ill myopathy, CSVT, acute ischemic stroke, and all the recent trials. So I'll show you one book which I have a PDF. So if you guys want that, I can share you in the neuroanesthesia classes group. So coming to the next principles of neuro ICU post-operative care, like management of airway ventilation, because the ventilative strategies for brain protection is opposite to ARDS. So these interesting topics can be asked for your exam. And then types of cerebral edema. I think we have got a question related to this topic. Types of cerebral edema for Karthik. We have got this for internals, right? Means the exam.
I think for no, I remember reading it for internals. I don't remember what theory.
Which was conducted by NAT board. Which was conducted by the NAT board. We have they have asked this question. Types of cerebral edema.
Yeah.
That was, if I'm not wrong, for our fact.
For our fact, exactly.
And then nutrition in ICU, rehabilitation, bedside procedures like PDT, sorry, it's a mistake. PDT, or then TCD, intraoperative neurology. Intraoperative neuro means this is again a mistake. And then the brain death is the favorite topic. So you guys have to read all the medical legal aspects of brain death. What is the criteria which has been followed in different countries? I think there is some differences in between the countries' protocols. So I remember reading this topic. Even I can share this. So you should have to be thorough in brain death criteria and type of apnea tests, and then maintenance of organ donor. And that's an important question if you consider, means if they want to ask a neurocritical care topic, that's the favorite question. Maintenance of an organ donor. So what are the targets of blood pressure? Thyronorm, how much has to be given? Steroid, how much has to be given? Should we continue the RT feeds? What's the target of the temperature? What's the target of EtCO2? Everything. So you should be thorough in that. And then basics of neuroimaging. Mostly this is this can be used for practicals where there is a separate session for imaging where there is a 25 marks dedicated station is there. So we are expected to tell about the basics of CT contrast, CT contrast, and then MRI and the various sequences, including the various TCD forms. In addition to all this, even bispectral index, or else the entropy, everything can be asked. But most of them, we can expect all these in for practicals. And then temperature regulation, hypothermia, role in neurocritical care, and what are the various trials which has been done related to hypothermia. I have a memo, means I have a presentation for this regarding this. I can share this in our WhatsApp group. And then miscellaneous topics like sepsis, carotid revascularization, whether carotid endarterectomy, general anesthesia, or the other one, which is the trial supported to them. And then types of cerebral edema, as I have told before. And then acute and chronic pain, chronic regional pain syndromes, neuropathic pain in trigeminal neuralgia. I have been asked about the facet block. So how to give a facet block and the surface anatomy of foramen rotundum for the practicals. So I didn't expect that question at that time. So with my experience, I'm just cautioning you. You guys have to know about all the foramen, rotundum, oval, everything in the skull base. You should be
Anatomy of
able
the
to
skull
go-
base.
Yeah, anatomy of the skull base, and then pregnancy in neurosurgery, and then cyanotic heart diseases, multi-organ dysfunction syndrome, trauma-induced coagulopathy, reperfusion injury, antioxidants role in TBI, end-of-life care issues. So all these are the important topics which are all of these are mentioned in the NATBoard site. I hope you guys have prepared all this. So theory, basically, I'll just read this slide. We have 3 papers, 100 marks each, and the duration of exam for each exam is 3 hours. And the time gap between the exams, Karthik, is it every day or means day by day, or have we got any?
Sorry? No. They'll be continuous. No break. 3
Okay.
days back to back.
Okay. Yeah. So as you all know, the candidate must score at least 50% of the maximum marks to qualify the theory exam, and the candidate scoring 150 or more out of 300 shall be declared pass, and they are eligible for appearing practicals. So I think some of you have a doubt about grace marks. So there are no grace marks for practical exams. Coming to the theory examinations, there are grace marks up to 2%. So if you guys means by chance if you score 144 to 149 out of 300 for theory, they may consider us, and we can means they may consider us passing. And then do you have any doubts still here? Shahid, Uzma, I think you can speak, because this is a mutual discussion. This is not a presentation.
Yes, sir. Yes, sir. Anil, sir.
Yeah, Shahid. So
Is there
grace
anything
marks
like?
are-
Is
What,
there
Shahid?
anything, sir, like your thesis should have been accepted before you submit your form?
Yeah,
No.
There
It's
is no.
only
Yeah,
no.
Karthik will explain that.
You just need to submit your thesis before the deadline. That's all. Thesis acceptance is not a criteria. It's just thesis submission. If you're, I think thesis acceptance will be a criteria for you to get your final results, if I'm not wrong. And
Result, okay, sir.
marks is out of 3 papers, you should score 145. Sorry, 150. You can score 20 marks in one paper and 80 marks in another paper also. But never aim for that. Aim for at least around 60-65 in each paper, so that you will be able to reach the 150 mark easily.
Okay, sir.
Yeah. And then practical exam pattern, even the theory exams are for 300 marks and practicals are for 300 marks. And we have to get 300 marks to clear the exam. So see, already there was a bit confusion for our practicals. Initially, we have been told like the practical pattern is ASCII. So even we have prepared related to ASCII pattern. But eventually we came to know that for our practicals, it was like a regular practical examination. So I think even for you, there will be some dilemma. So I think you should be aware of this. So you
I
have
think
to.
how many candidates are there this year?
8 candidates.
8 only. So okay,
Yeah.
8, and if at all you have any post PM people writing the exam, so take it for granted you're going to have a clinical examination in one, probably in Delhi. This is going to be
Okay.
the site for exam. So because same thing happened to us. Initially they said it's going to be conducted in your same state and all that. But finally, we in the last minute we got a mail saying everybody, the exam is in Delhi. Please come. No, and on this thing they'll tell you this is one pass to travel anywhere against the COVID restrictions.
Okay, sir.
Yeah, practicals, even we have to get 150 out of 300. And the number of maximum attempts for practicals are 2 attempts. So the first attempt is immediately after the result declaration, and it is a mandatory attempt. So if you're absent for this practicals, they'll consider it as an attempt. So there will be only one more option for you. So this is the mandatory attempt, because one of my seniors, he has intentionally he didn't appear for the practicals after clearing the theory. He thought like he has 2 attempts, so he can use that after his thorough preparation. He didn't appear for the first practicals, and then later he came to know that it was considered as a presence, and there was only one attempt was left for him. So please don't do that mistake. So give your first attempt, because it is counted. It will be counted. So the second attempt, you can take a time for at least for one session. So you need not you need not appear for the immediate second session. You have a chance, so you can actually skip that. So, and then mark distribution for practicals. So for practicals, there is one long case for which 100 marks is there, and for 2 short cases, 25 marks each. The time duration for long case case presentation is 1 hour, and for short cases it is half an hour. And then 25 marks for our thesis and logbook, 25 marks for drugs, 25 marks for instruments, 25 marks for imaging, and 50 marks for topic of interest and viva. So topic of interest means you'll be asked like, what's your favorite topic in neuroanesthesia and neurocritical care? If you talk about I am interested in acute ischemic stroke, they may ask you about all the recent trials, what are the various trials, the extent trial, so many trials are there. So you may be, means they'll allow you to talk about your topic of interest, and you'll get some questions related to that. So this is the brief
Marks distribution.
of
So regarding thesis, they will ask something about thesis, or they will check our
Yes.
hard copy.
Yes.
They'll take
They'll
at least
ask.
half an hour. They'll ask us how you form the aim, primary aim, objectives, primary objectives, secondary objectives, your methodology, your duration of the study, and what software have you used for statistics.
Okay.
So we should be very thorough. And then even you may get questions like the topics about your introduction. On what basis have you done this study? Can you quote some of the articles like that? They may ask. Means even they won't expect the complete topic, but you are expected to talk about them.
They're just going to assess how well you know your thesis.
Okay.
Yeah. So, and then see, these are the books which we have prepared. So I think that's why I have just mentioned. So just to give you a brief idea. So these are the books which are Zulfikar Ali sir have written. So we initially, it came as a single volume. So I think it was 4 or 5 years before old edition, I guess. Sir, is it correct, sir?
I think sir is busy.
In some other meeting.
Mm.
Okay, so this is the latest version where it came as 2 volumes. So you guys can read only these 2 books and you can appear for the exams, because
It's
it has
good.
everything. It has everything. See, quarterly is more related towards neuroanesthesia. This is what we came to know after reading that. So we have read these books in the last 6 months. So everything is there in these 2 books. So you guys can start reading this. And it is very easy to understand, and it is very easy to reproduce also. And then see, coming to the biostatistics, I think everybody can see this. So this is the biostatistics manual, which I have a PDF. So if you guys want to read, you can share
just
the.
share
Yeah,
it
please share it.
It is hardly 90 pages book, where you can have everything about the biostatistics related to our
Or
medical.
at least some basics idea you'll get out of that book.
See, even our friend colleagues, all the DrNB students, they got questions like positive predictive value, and then so many modes of distribution, so many other things.
The gastro guys, if I'm not wrong.
Yeah, gastro guys. So luckily, means even though we have prepared, we have not got any questions related to biostatistics.
Stats.
Yeah. And then see, this is the another interesting book, Neuroanesthesia, Oxford textbook, where the basics of neuroanesthesia is very well described here. So you guys can just flip this book. And then for neurocritical care topics. So these two books which we came across, these are, we have prepared these two books. I don't know about you. And then this is the exclusive book only for trials. So I have, even though I don't have a PDF of entire book. So this PDF, this book has 12 topics, I guess. So I have all the individual PDFs of all these 12 topics. So I'll share all these trials in our group. So you guys can read this. Yeah. Thank you and all the best. And if you have any
Thank you,
queries,
sir.
please ask so that we can discuss.
Okay, I think Anil, we can just tell them
Yeah.
what we went through in the practical. I think, see, me, Anil, and Shubhajit are here. So during our practical exam, it was in GB Pun, and we had a lot of support from all the DNB candidates there.
Yeah.
Karandeep, Chayanika, everyone was
Literally,
great
they
help.
have saved us.
Exactly.
Yeah,
Really.
Yes.
they did a great job helping us out.
Mm.
So that's what we went in. They assigned us our cases, and when I went for my case discussion, okay. So for the long case, you have to present everything. What are the presenting complaints, and what all history have you elicited? What negative history have you elicited? And what they asked me at the end of my case presentation was, what is your anatomical diagnosis? What's your pathological diagnosis? What is your most probable final diagnosis? Like I had a case of subarachnoid hemorrhage. So they said anatomical diagnosis. So from the symptoms, I had to tell that, okay, this, whatever pathology is there, like whatever issue is there, has come from the like the anterior part of the cranial cavity. Then pathological, it could be a vascular issue because the symptoms have come suddenly. What could be the most probable cause? Could be a subarachnoid hemorrhage. Then they'll go into the examination part. Then after that, to the treatment, what are the various treatments you have? Like you can do endovascular, you can do open surgery. So what are you going to do? And then further complications. See, subarachnoid hemorrhage is a chapter by itself. So they went through with everything for me. Then short cases, they'll ask you to just present the history and tell, okay, what is your most probable diagnosis?
Only positive history for short.
Only don't waste too much of time on the short case.
And history taking.
Because time just flies. Time flies. You will not realize what is happening. And all of a sudden, you'll realize that you've run out of time. You can't write anything. You can't prepare anything. So don't waste more than 10 to maximum 15 minutes on history taking and examination for your short case. And so use the remaining 15 minutes to just write up and prepare yourself mentally as to what you're going to talk. There they can, like say, any case, any presentation, they can go anywhere, everywhere. So this is what I went through. I think Shubhajit can throw some light on what he went through. Shubhajit?
Yes, Karthik, yes, I'm here.
Yeah.
The first thing I just want to tell you that whenever, means what I have felt like, means when you are writing a theory question paper, then say in the first paper, one of the question was, describe the principles of neuroprotection, then discuss the various strategies for neuroprotection during neurosurgical procedures. So it is always better when you are writing a question number 1, you have to write according to the order, all the questions. And you will be supplied 5 booklets, and each booklet contains 10 pages, including the cover pages. So there are 8 pages in each booklet. Total 5 booklets will be given. That means you will be getting 40 pages. So when you are writing your first question, it is better to mention the topic. Like first topic is neuroprotection. Just underline that thing. First part is the principle of neuroprotection. So just mention the topic, principle of neuroprotection, then you start writing. The second part is the various strategies. So you just write various strategies for neuroprotection. There you start writing like that only. So this is my first tip. Second tip is only write everything point wise. Don't write an essay, don't write a big paragraph, but try to mention all the points very briefly and neatly, as neat as clean as possible. So this is the first thing I want to mention in the theory part. Second thing is that means whenever you are getting a chance to put a flow or a flow diagram, put that thing only. Achha. Third thing in the practical, what Anil and Karthik has already mentioned, the thing is that when you are given a long case, so after taking long case, the history will start with history, then it will start with then clinical examination, investigation, then anesthesia proper. So in the history, they will be asking you regarding the anatomical diagnosis, the pathological diagnosis, like that only. And of course, what Karthik and Anil both has mentioned, in the short case also, you will be given, whatever short case you will be given, you have to better to mention the positive history.
Yeah.
So that is the thing actually.
Guys, for me, see, I have not mentioned, followed the number order for second paper. So my friends who have done the DNB, they have scared me like I'll be flunked because they won't consider all this thing. They have clearly mentioned that numbers has to be followed, and we should write our answers on the number order.
Number order. Right.
Yeah. So I didn't follow that for this second paper. Luckily, by God's grace, they have cleared they have corrected my paper. So my suggestion to you is please stick to the sequence of the order. Yeah, and write the questions based on the order. And then for our practicals, I have been asked, as I told before, I have been asked about the facet block. So facet joint block means that was after so many years I have heard that topic.
Word.
So just like that, I have blabbered something. So they'll ask like anything, and then they have asked one question: which current is present, AC or DC in DFib? And then they have asked us about detailed discussion about DFib. So I didn't expect that question too, because there were so many other monitors, so many other topics. So anything can be asked. So this is similar like anesthesia. So
I think one CPS station was also there. And though I have not faced one, the CPS station was also there.
Yeah. So even you may be asked like ACLS guidelines about everything. So you should be prepared.
Yeah, that is there. Yeah, and I think during our Viva, they asked me about I think couple of CTs, MRIs.
Right.
And then they ran me through the different instruments that were there. They asked me everything about an ultrasound machine, and they came to NIRS and some other machine. I remember they asked me the principle of how NIRS works, what is the working principle, where all do you use it, and they said, okay, I can deal. Then the other station where I went, they started with antibiotics. They told me, you pick this thing, induction agent of choice, and talk. So I was happy to pick up Dexmed, and I spoke about that. Then about antibiotics, please be thorough, because that will be a sure shot question. And then after that, 3% saline, mannitol, and
and then I think ketamine, etomidate, propofol, thiopentone, and then muscle relaxants.
Then as Anil mentioned, vasopressors. Then as when Anil mentioned, they asked me, okay, what is your thesis? What is your topic? How did you pick up your topic? Which is the parent article? Where did you get it from? They asked me about the parent article. They asked me about my study. They asked me about how it was. Was it similar? Was it different? And then finally they asked, okay, out of in your 3 years, what was your favorite? What topic did you like in teaching or anything? And what, if you're given a chance, would you like to pursue doing more studies about it? So I chose to talk about stroke. I was more comfortable doing that. And for us, lucky, it went on smoothly.
Karthik, see, sir has asked, Zulfikar sir has asked us to present even the drugs, equipments, and imaging dude. So yeah, you, me, and Subhajit can share the topics, and we can just do our presentation maybe in another 2 weeks. When are your
Okay.
exams?
Sure.
No, I think this. Oh no, drugs. I think we can do it even after that theory.
Yeah.
Because see, okay,
Yeah,
one
before the
more.
practical exam, it is better that we can do it. No problem.
Yeah, and yeah, just two more points. So there is one. What? Sorry, just give me a second. Please. Okay, kids. I'm sorry.
I was given ICG also in the drug test.
Yeah, dude. Even for me, they have asked Indocyan and green. Yeah.
Okay. So there are a few WhatsApp channels. There is one by ISNAC. It's called Classroom. They have covered a lot of topics. So you guys, like say when you're taking a break to have lunch, have dinner, where you just want to get your mind free, or you just want to change a topic, just switch these on YouTube and sit, and it's going to be very useful. I think they've covered intraoperative neuromonitoring and about MRI anesthesia and MRI suit, all that very well. Then that is one. And for theory, please prepare topics for 10 marks. So that even if they break your question, you can write a 10-mark question for 2 marks also. But if you prepare something for 2 marks and they give you a 10 marker, you cannot write this 2 marker for 10 marker. So please prepare all your topics thinking you're going to get only 10 marks. Don't sit and read essays or long bigger topics.
See, my suggestion is you should know something about everything, not
Exactly,
something about something. So you should be able to answer those questions at least.
You have to attempt all the questions. Don't leave any question.
Yes, please attempt all the questions and write something relevant. Because at the end of the day, what they say is, see, whoever is coming there to pass you. Don't give them a reason to fail you.
Yes, sir. Karthik sir,
Yeah.
do we have practical exams soon after our this theory exam?
No, see, your practical exam is going to be only after you have passed your theory exam. So they'll take time to correct your theory paper. They'll take time to publish
Actually,
your
sir,
results.
our theory dates have come out, sir. We have our theory exam in June.
I think June.
Yes, sir.
So June, July, August. I think your practical is going to be sometime in August. See, we wrote our theory in March. Yeah, we wrote our theory in March. We wrote our practical in August.
Yes.
Okay, sir.
Ours though was an exceptional thing. So yours, I don't think is going to go that long. So be prepared for a practical at around August.
Okay.
The more time you get, the better. Please try to stay in touch with your books, because the